In taking the blood pressure, assist patient and assume a correct position. This promotes patient comfort and relaxation. Remove or rearrange clothing to expose the area where the cuff will be applied. This is to avoid any disturbance while taking blood pressure. Extend the arms with the palm facing upward. Place the cuff approximately 1 to 2 inches above the inner aspects of the elbow with the bladder over the brachial artery. Blood pressure increases when the arm is below the level of the heart and decreases when the arm is above the level of the heart. Arrange the manometer gauge at eye level. This is to ensure an accurate reading. Palpate the brachial artery or radial pulse by pressing gently with the fingertips. Tighten the screw valve on the air pump and inflate the cuff while continuing to palpate the artery. Note the point in the gauge where the pulse disappears. Deflate the cuff and wait for 15 seconds. To prevent leaks during inflation, ensure the cuff is inflated to a pressure greater than the client's systolic pressure. Place the stethoscope earpiece to the ears properly. Then position the diaphragm of the stethoscope firmly but with as little pressure as possible over the artery where the pulse is felt. Do not allow the stethoscope to touch clothing or the cuff. Sound is heard best directly over the artery. The head of the stethoscope under the edge of the cuff results in considerable extraneous noise and may cause inaccurate readings. Pump the pressure 30 mmHg above the point at which the pulse disappeared. Ensure that the cuff is inflated to a pressure greater than the patient's systolic pressure. Note the point on the gauge at which there is an appearance of the first faint but clear sound, which slowly increases in intensity. Note this number as a systolic pressure. Read the pressure to the closest even number. Release air entirely from the cuff and remove the cuff from patient arm. This prevents arterial occultation and patient discomfort from numbness or tingling sensation. Disinfect the diaphragm of the stethoscope using alcohol swabs 3 times. This ensures safety since it prevents cross